Hi, my name is Kara Ann. I am owner of Pooch's Pets and Pals Mobile Grooming and CEO of Pals for Claws and Paws nonprofit. I want to let you know I have 25 years experience in every aspect of animal welfare, but just to name a few: animal control officer, shelter medicine, veterinary medicine, holistic nutrition, acupressure, and grooming are just a handful. There is so much more that I do. And because of my background, I take on the cases that most groomers can't handle, or the dogs that groomers turn away. And my motto is, if not me, then who? Hey, welcome to Pooch's Pets and Pals Mobile Grooming. A little bit about myself. My name is Kara. I have 25 years experience in every aspect of animal welfare, from animal control officer to shelter medicine, veterinary medicine, nutrition, acupressure, farrier work, dog training, and of course grooming. Because of my extensive background, I usually get all the difficult cases. So the extreme geriatrics, the high aggressives, the reactives, ones with health issues, high anxiety, and ones with difficult skin issues. So today with us, we have Misty, but she's not the dog. Misty is my wonderful, wonderful helper. And this is Miss Abby. She's a 10-year-old border collie, and she has a lot of arthritis, and she had a recent fall off the bed. So we got to watch not to overextend that left hip. Now, with my geriatrics, I am going to monitor her blood pressure and her respirations and her heart rate. I do this for all my geriatrics, and as you can see, she is completely compacted in the pant area. So we're going to be taking care of that. I'm going to be grooming her on the floor today to try to limit moving her around. And then when we have to get her in the tub, we will use a lift. Abby is very high anxiety, and is just, you got to be very slow and gentle with her. So meet Abby, everybody. Yes, girl. And that yawning right there, and that lip licking. Did I say that right? That is a sign of nervousness, not aggression. But you know, high anxiety dogs tend to turn aggressive if they're pushed too far, because it's called stress stacking. So we want to make this as stressless as possible for this dog. And that's another reason I monitor heart rate, breathing, and blood pressure, because grooming is stressful period on any dog, but especially geriatrics. So say hi, Miss Abby. Yeah, it's a good girl. Hey, we are back with Miss Abby, our 10-year-old Australian Shepherd or Border Collie mix. Oh, my brain does not work. So what a lot of groomers make the mistake of doing is not de-shedding enough before bathing, because you cannot let dead impacted hair, or it's going to impact more. This dog had so much hair taken off. I mean, this is like a small amount of it. So we did a lot of hand work on her. A lot of things I'm noticing is she's got really dry skin. If you see this white powder, that is dandruff and just dry skin. I mean, it's everywhere. I'm going to recommend to mom that we increase the frequency of her groomings, and I'm going to recommend some diet changes and some supplements. She is going to be getting a TheraClean bath today. A TheraClean bath is a micro bubble system, and is right here covered in her hair. It's a very expensive system, but what it does, it turns regular water into micro bubbles that can penetrate the skin, and they kill all bacteria, boop the snoot, bacteria, fungal, yeast. It cleans out all the old sebaceous oil to allow for healthier hair growth to come back in, shinier hair. You could tell her hair is really, really dull and just very, very dry. We got what we could out. But before we even do a TheraClean, she's getting a full de-shedding and a de-clarifying solution. And before I shampoo any dog or even have them as a client and work on them, I do a full medical history. I go over food sensitivities, any allergies or anything. Um, and I really go above and beyond for my clients to ensure their safety. That's why they call me, because yeah, I might not do show cuts, but I can guarantee your dog is going to get the best care they could possibly get. And the way I do things is the proper way, and I put safety and their health at my top priority. Sorry, Misty, you come last. No, actually I do, my safety. I'm just joking. So we're getting ready to get her in for her clarifying and de-shedding shampoo, then a rinse, and then we'll bring you back when we do the TheraClean. Abby!